Let's get more in that news. Out of the US, that Donald Trump is indeed heading home from hospital, and he's doing that in the next couple of hours.
The president has received experimental drugs as part of his treatment, and to find out more, we're joined by Dr Norman Swan, presenter of RN's Health Report and the ABC Corona Cast. Norman, good morning. Can you make sense of it all for us, please?
Hi, Lisa. The problem is you can't believe very much that's coming out of the White House at the moment. There's been contradictory statements again and again. He needed oxygen, he didn't need oxygen, and his true status was probably worse than they said. So it's very hard to know. But if you actually just bring this down to ordinary human terms, imagine you were in hospital, you're not doing too badly, you've got a reasonable house at home where you could go home and isolate, then there's not much point in being in hospital, and you can go back in if you get worse. So if you're not sure, you wouldn't be necessarily sent straight home if you've got COVID-19 in Australia from a hospital, but the issue is quarantine. And of course, that's the problem with President Trump, is that he has not obeyed quarantine. I mean, it was totally extraordinary, this trip in his van around the outskirts of Walter Reed, where he was endangering the lives of his Secret Service agents just to say hi to his fans. That was an extraordinary neglect of the rules, and you would never have seen a leader in Australia doing anything like that. It says a lot that he did that and put his own staff at risk.
And Norman, he is going back to the White House, which as is fast turning out to be a coronavirus hotspot, and a very hot one too.
Yeah, so it's the focus of an outbreak. Whether the Rose Garden was the super spreader event is unclear. Probably was. Very few people in that audience were wearing masks, although it was outside. But there's no question, you're right, that the White House in some shape or form has been a super spreader event. Not quite the size of Chadstone, but it's getting up there, and we probably will never really know. But coming back to your first question, Lisa, about what do we know about his drugs, that's been that's been quite interesting. Essentially, he's had unproven therapies, is the bottom line of his treatment. And you've just got to take a range of possibilities here. One is that he's been more seriously ill than they say, and that's why they've given him the drugs, or they've panicked and they're just throwing everything at him. He's just said, just give me anything, it's not going to kill me, it's fine, I'll just take it, just give it to me. And I suspect that's what's happened without any inside knowledge that that's what might have happened. So he's had dexamethasone, which when you're severely ill with COVID-19 in an intensive care unit going towards ventilation, that will save about 20% of lives. He's had remdesivir, which is an antiviral, which doesn't save lives. It might get you out of hospital a bit sooner. But again, if you're moderately to severely ill, not if you're mildly ill. Although he had moderate symptoms. And then he's had this cocktail of monoclonal antibodies, which have had anecdotal benefits, but we've not got any scientific evidence yet that they work. And there's a possibility that they might not work, since the virus that these monoclonal antibodies has been designed to attack is the Wuhan virus of earlier on this year, and the virus has mutated since. I mean, I hope that these help the president. The reality is, though, if he's going to fall off the cliff with this, it's going to be Wednesday, Thursday, Friday, Saturday of this week. So he may well be returning to hospital. I hope not. And the signs that they're sending him home are good, but I imagine that this is the patient from hell.
We will keep you on speed dial, Norman. Hey, can we zip across the Atlantic? I want to go to the UK, where the head of the vaccine task force has suggested that only people at risk might get the vaccine. Are there going to be some tough decisions that have to be made about just who gets it?
Yeah, they've had a vaccine reset. I think they discovered that most British people thought that everybody was going to get the vaccine when it became available. And the chair of their vaccine task force has said, or at least reported as saying that they will, when it becomes available, it'll be people over 50, people at risk, healthcare workers, and aged care workers. So, in other words, the reality is that's what it's going to be like in Australia too, is that you're not going to have enough vaccine to immunise everybody day one, and you will go for people who are most vulnerable to the disease, COVID-19. And remember, the vaccines are not designed to prevent infection, they're designed to prevent COVID-19 disease. So you would give it to people most likely to develop COVID-19 disease, or if they got it, it would not be a good thing for the community. So first responders, police, ambulance, and that sort of thing. So that's what they did. They were just resetting expectations.
Norman Swan, we're going to have to leave it there. Thank you so much for joining us.